we're going to start out with some general healthy eating in terms of cancer, lung cancer specifically. You know, you've heard of plates and pyramid models, like what's the best approach for eating in terms of cancer survivorship? And in my estimation, the best way to eat, and I know you can't see each one of these pyramids, they're really tiny, but I'm showing you 5 different pyramids on purpose. And the reason is this is not a one-size-fits-all approach. In fact, the Mediterranean eating pyramid, which is the basic template of what I'm showing you here, I believe needs to be adjusted to take into consideration people's culture and history and the foods that they love eating, and not just be one standard thing. So if you're looking for a good guide to how to eat as you go through your lung cancer experience, the old ways, food traditions, pyramids are the ones I would direct you toward. And I'll just briefly see here, you can see the African heritage pyramid, the Asian pyramid, the Latin American pyramid, the vegetarian and vegan pyramid. You can choose the one that most resonates with you. It most represents the foods that are part of your background, culture, and palate, the things you enjoy eating. So that's the first thing I'm going to say. You may have also seen the healthy eating plate. I'm just going to focus on 2 things on this plate. One is, see how the plate is there's a line down the middle where veggies and fruits are on the left side and whole grains and proteins are on the right. I'd like to have us think about the goal of splitting that plate in half, so that half of the plate is plant-based veggies or fruits, and the other half of the plate is divided again by 2 into whole grains and proteins. And that's going to frame up what we talk about today, along with things like hydration and getting enough nutrients in. So when we think about these things, there are a few things that, generally speaking, when it comes to lung cancer, we want people to do more of, and a few things that, generally speaking, we'd like them to do less of. So on this slide, I organized it that way. The goal for many people is to try to eat 3 vegetables a day, 2 fruits a day, some whole grains. What I mean by that would be like brown rice or whole wheat bread, nuts and seeds, and to move their body in a way that's comfortable and appropriate for them. It's not the same for everybody, right? This is not about going to train for a marathon. It's about taking a walk, if that's comfortable for you, right? A 10, 15, 20-minute walk if it's comfortable for you. The things that, generally speaking, are recommended to do less of with lung cancer are less red meat. Notice how I didn't say no red meat. The recommendations for red meat are 3 times or less a week in a serving size that's the size of a deck of cards. So for those of you who like a hamburger or a roast beef sandwich, the goal would be to try to have the amount of red meat you eat be 3 ounces, so like a deck of cards, and 3 times or less a week, okay? Processed meat. What do I mean by processed meat? Bacon, salami, bologna, hot dogs, that kind of thing. The goal with processed meat is to eat less of it overall. And we can talk about why of all of these things as we're going along, but I want to just get you right to the heart of the matter. And the same is true with sugar-sweetened beverages and alcoholic drinks. We are going to spend some time today on the most common thing I hear, the most common question I hear, which is this one: does sugar feed cancer? We're going to talk about that today, okay? What are the goals we want to focus on when dealing with lung cancer when it comes to nutrition? We want to make sure we're dealing with the side effects of treatment that can make it more difficult to eat. Optimize nutrition, which has been shown to help treatment be more effective and to help people maintain their weight as best as possible and feel their best self, feel like they have the energy to take a walk or do the things they enjoy doing. But these are the 6 things I hear about most commonly from people as they go through lung cancer. I don't feel like eating is one. My mouth is sore or is painful when I eat. Things don't taste and smell like they used to. There's difficulty with pain and or problems with food going down, nausea and vomiting, or losing weight without trying. These are the most common 6 things that people, and some people have 1 or 2 of them. Some people have 1 and later they get a different one. So these are the 6 things. I'm going to spend a few minutes on each one of these problems. And then if you're having another challenge, like the cholesterol, the woman, the person who put in the question about cholesterol, and cooking for one, we can talk about those things as well. So let's start with I don't feel like eating or loss of appetite. These are some of the recommendations for how to manage loss of appetite, which are rather than eating breakfast, lunch, and dinner, to try to eat 6 or 8 smaller things a day. Meals that might be on little plates, like dessert-sized plates instead of full-size plates. There's some very interesting research that when people lose their appetite going through cancer treatment, that if they have their regular size plate, they eat less. Because looking at their usual size plate of food can be overwhelming. So using smaller plates or bowls actually can help people to eat more. You might also try adding flavorless oils to food wherever you can to bulk up on calories. I'll give you an example. The person I just got off the call with right before coming here with you eats an English muffin mid-morning as a second breakfast to get calories in, and typically puts just butter or jam on the English muffin, but likes peanut butter. So we came up with a plan where he's going to keep avocado oil, which is a flavorless oil, next to the toaster in a little jar with a lid on it, and get a pastry brush. And when he toasts the English muffin, brush a little avocado oil on it before putting peanut butter or jelly. Because avocado oil has, like I said, no flavor, but it's extremely anti-inflammatory, and it gives another 140 calories of healthy fat without him having to eat more food. So that's just an example of how you can get more calories, more nutrient density in without having to eat more food. Now, you might have already heard about trying supplements, shakes, and smoothies, some of which people are like, they're gross, they're sickeningly sweet, I can't eat that. That's okay. No pressure to do that. I am going to put into the chat a link to 4 of my favorite smoothies and shakes. And stick with me here. Some of them include vegetables. I know that might sound crazy, but if you're having trouble swallowing like salads, some of these smoothies are going to incorporate not only just greens, but like carrots and ginger and a variety of things. I'm going to put that in the chat for you as well. And then the last thing I would say is that some people, when they have loss of appetite, do better if they're drinking fluids in between their meals than at the same time. When they're eating and drinking at the same time, they get full from the fluid and they can't eat as much in terms of the food. So sometimes we separate the liquids out so that they're in between the meals. Okay. Now, show of hands, how many people, and I can't see all of you right now, have noticed changes in their taste and smell? Keep your hand up for a second. Yep. Okay. This is a common one. So you probably heard some of the tips and tricks, like use citrus, you see I have here, right? Or add herbs, or use different, like Mrs. Dash, and marinate your foods and use sauces. Those are totally fine. You can do and maybe you've already tried all those things, right? That sometimes happens. What I'm going to share with you today is a slightly different idea for how to manage when your tastes and smells are off because of treatment. So what I'm showing you here on the slide is that there are 4 components to flavor. When people might say to me, my tastes have changed, I tell them, okay, taste is only one of the 4 components of flavor. Taste, smell, texture, and temperature are the thing that give you the sense of flavor of a food. I think I saw you raise your hand with the taste smell changes. So I'm wondering if you'd be willing to unmute for a second. Can you tell me or the whole group like a food or a food right now for you that's just does not taste like it should?
Oh, it's so many, and I don't know it until I try them. And it's the after taste. I can put it in my mouth initially, some foods, but then once I swallow and it's gone, it leaves a disgusting, lingering aftertaste. So it's like, okay, I don't want no more of it. So I've only taken 1 or 2 bites of, that particular food.
Okay.
And even some foods, if I smell, Stephanie, when I smell them, it can actually upset my stomach.
Yeah.
And that's even before I eat it.
And then it makes it really hard to be able to eat it, doesn't it?
It does. It does. Now, I like Italian food. I don't like garlic, but I like Italian food. But it comes and goes. Sometimes I can eat it. Sometimes I can't. But it's different foods.
Okay. So, I'm really glad I asked you to unmute, because I think what I was about to say, I'm going to say something different, and then we're going to come back to what I was going to say. Because Paula, in this, and anybody else who has the same thing that Paula describes, where you take a bite or two, and then you get this aftertaste that's just really unpleasant. Here's my suggestion for that. Do you know pomegranate juice? Pomegranate?
Yes.
Pomegranate juice or cranberry juice. Those are the 2 liquids that are best at clearing that really bad taste that can be residual after bites of food.
Okay.
So my recommendation is to take a glass of water. I don't know if you can see my glass of water. And with some water in a glass, put like equal parts cranberry juice or pomegranate juice with water, like dilute it out a little. And when you sit down to your meal, sip on that pomegranate or cranberry water mixture. Because, take 2 or 3 bites, like you say, and then sip on that cranberry or pomegranate.
Thank you.
Of course. And the smell problem, you see, I have a picture of freshly sliced lemons here. That's because when you're hit with that smell, I hear from so many people who even just open the fridge, and there's nothing bad in the fridge, but they're just like, oof, it's like this terrible thing. My recommendation is to slice a fresh lemon and sniff it. You just keep that wedge of lemon on the fridge for the whole day and you sniff it, because the lemon overrides the part of the brain that's got smell sensors that are overreacting to everything in the environment.
Thank you so much. Yes.
Of course. Okay. So those are a couple things that I wasn't planning to say, but this is the goal. I don't want to just be me talking at you. I want to make sure we get to what's at the heart of going on. Okay. So, but I will just really quickly tell you this other trick that you can try if flavor of food is off for you. And remember how I said taste is just one component of flavor? Let's say that you were trying to eat cantaloupe and it tasted like the bottom of a shoe. Now, this is one that somebody told me just the other day. That I didn't make this up. This is like, I'm trying to eat cantaloupe and everyone else in my family says it tastes delicious. And for me, it tastes like the bottom of a shoe. Probably not something you want to eat a lot of, right? Cantaloupe is juicy, wet, cold, let's say. Temperature, texture, all these things, and smell, we can play around with those. So you want to find something that's the opposite: texture, temperature, and smell. So the thing I suggested for her was oatmeal. Hot, creamy, cinnamon. Now, I know, I saw you made up, right? When would you ever eat cantaloupe and oatmeal together? It sounds disgusting, right? But when your flavor is off because of treatment or other things, if you take things that are different, opposites, and you put them together, not mix them together, eat them side by side. You eat 3 or 4 bites of oatmeal with cinnamon and a bite of cold cantaloupe. Or like you could do soup. That's why soup and crackers works. Does anybody have oyster crackers and soup works for you? Yes. You know why? Because it's hot, liquid, and dry, crunchy together. So this is, if you're struggling with taste changes or smell changes, this is my advice to you. Get creative think of whatever the thing is that you're eating and try to pick a food that you can even have a few bites of that's the opposite texture, the opposite smell. It even works if you just get out the cinnamon or the tarragon or the whatever's in your spice cabinet and smell it. Just smell something different while you're eating the thing that's not tasting good. Because it's super fascinating to me how the brain works. The tongue, right? The taste buds, that's only one part of how the brain receives flavor. The brain's looking for some sort of a smell, some sort of a temperature, and some sort of a texture. It's scanning for all of those things all the time. So even if your taste buds aren't performing like they used to, you can actually make the experience of eating less, like a little less awful, oftentimes, by just getting some opposite things. Now, the people in your family and friend groups might think you're eating crazy stuff. Like, why is she eating a cookie alongside of like, chicken soup? Who cares, right? Who cares? They might actually pay attention and be like, that's interesting together that you like those things together. You're looking for opposite textures and temperatures, warm and cold things together work. Yeah? Okay. Let's keep going. Nausea and vomiting, I'm not going to spend a lot of time on because here's the thing. There's a lot I could say about it, but the key really here with nausea and vomiting, especially if it's treatment induced, is to stick to those medications that your doctor is prescribing because there aren't a lot of nutrition tricks that can get us out of that situation. Food odors can be a huge problem you already don't need me to tell you that, right? So smell those lemons and eat every 2 hours. Really important. If you're nauseous, having an empty stomach makes things worse. That's because the stomach keeps producing digestive juices. And if they're sitting in your stomach with no food, they make the nausea much, much worse. So even if you can only eat 2 crackers or a little squeeze of applesauce, that's better than nothing. Because then the food gets into your stomach. The digestive juices in your stomach work on that food and they move on through. They don't just sit there pooling in your stomach, making the nausea worse. Okay. In terms of what to eat, if you get the nausea down, let's say your nausea is at a 7 out of 10 and you can't eat, but then you take your meds and it drops down to like a 2 or 3, things that are room temperature or cold work best, unless it's like a broth. Like warm broths can work well to sip on because they're the high salt. Salty foods work well for nausea. Dry, salty foods, so crackers or toast or English muffin. Eggs work unless the smell of them is putting you off. And then it's, if you have somebody in your life who wants to do something nice for you, they could make you like hard-boiled eggs or deviled eggs or something where you don't have to deal with touching and smelling them, right? Do you know the one food that works really, really, really well besides saltine crackers when you're nauseous? And you're going to be very surprised to hear a dietitian say this. Potato chips. Potato chips are high in potassium and sodium. And those are the 2 things that make the biggest difference when you're nauseous. So it's not uncommon for me to tell people, keep a bag of Cape Cod potato chips in your cabinet. If you're having a day that you'd have to take your nausea medication and you're really still feeling a little nauseous, eat 5 or 6 potato chips and wait 10 minutes. And usually people start to feel a little bit better. The problem is, don't keep eating the potato chips after that because unfortunately they're greasy and then you might end up with a stomachache. The potato chips are kind of like a little bit of a medicine. You can eat 10 potato chips and then you might be able to do a little bit of soup or a quarter of a sandwich or some cereal or some chicken, whatever. Okay. I did see some hands go up or head nods with a difficulty in pain swallowing. So I'm going to spend a minute here. I've got a recipe here on this screen that's pretty intense. Let me just tell you. Not intense in flavor, but it's a lot. See, it's a cup of liquid. What I mean by that is could be a cup of orange juice or yogurt or water or milk or lactose-free milk or almond milk with fruit, protein powder, avocado oil, peanut butter, Greek yogurt, and rolled oats. Now, you certainly could omit any of the things in that if you need to, but this shake is basically, well, you see, right? It's basically like having a cup of something to drink, 2 servings of fruit, 24 grams of protein, a serving of yogurt and oatmeal with peanut butter and some healthy oil, like a salad dressing. but in a flavor that is of your choosing. I actually have a patient yesterday who made this, and she made it all with frozen mango. You see how in the blender right here, I have, like, this is just a blender full of berries. It's really not the recipe, but she did 3/4 cup of straight up mango and made a mango shake. And then what are you going to do with that shake? You could put it into a container and sip on it throughout the day, keep putting it back in the fridge. Or what she did is she blended it up and put it into homemade popsicle molds. And because she's having such pain with swallowing right now, she's eating these popsicles that dissolve and slide right down, but they're loaded with nutrients. Okay. If you're losing weight unintentionally, besides the ideas of a nutrition shake, some people end up making something like these energy bites. You can either make them with like a peanut butter base or with a date base. And don't worry, I've got recipes for you for this too. You make a batch of these little things. They're all these different flavors they come in. My kids happen to love a peanut butter chocolate one. You can keep them in the freezer. You can keep them in the fridge. And 2 or 3 of these little energy bites can give you like 8 to 10 grams of protein and another 300 calories. And they're the size of a donut hole. So they're really little. So this kind of thing, if you're losing weight or energy and strength, eating 1 to 5 of these a day can be an extra way to get more nutrition in. Now, let's get to the part you've all been waiting for, the sugar-feed cancer. Because people will say to me, oh, I really can't eat something like these date balls because they have sugar. They have honey in them. The recipe for these often contains some honey. And people say, well, I'm off sugar. So I want to just clear this up. When you hear sugar feeds cancer, that's an oversimplification of what actually happens when we eat sugar. It's not that when you eat birthday cake or pumpkin pie, that sugar goes right to cancer cells. That's not how it works. But it is true that we don't want to just eat sugar like all day long with no consideration, right? There's a bit of a, there's a goal here to how to think about this. So sugar or glucose is the fuel for all of the cells in our body. It's how our hearts beat, our brains think. It's why we're sitting here right now having this conversation. If we didn't have glucose, we wouldn't be able to do this. All foods that contain carbohydrate have glucose in them. So brown rice has glucose, just like white bread has glucose, just like carrot cake, just like oranges, just like donuts, just like ice cream. These are all foods that have. The difference is some of the sugars are naturally occurring and some of them are added sugar. Okay. Now, you can do this little example in your own house, and you can do it now if you want to in a minute. We're going to differentiate between added sugar and naturally occurring sugar. Added sugar is just like it sounds. When they're making yogurt, this is just an example, you can get plain yogurt with no added sugar, or you can get like raspberry flavored yogurt that's got, depending on the brand, somewhere between 16 and 24 grams of added sugar. If you like raspberry yogurt, you don't have to live without it. The idea would be either you buy a raspberry yogurt and plain yogurt and you mix them together, so you cut the sugar in half, or maybe you buy frozen raspberries and cook them down on the stove with a tablespoon of water and make your own raspberry puree and add that to plain yogurt. Even with a little bit of honey in it, you see, because 1 teaspoon, think about your teaspoon in your kitchen, like your baking teaspoon. 1 teaspoon of sugar, 1 teaspoon of honey is 4 grams of sugar. Most yogurts have 4 times that much. So if you think to yourself, yeah, a teaspoon of honey would be enough for me to sweeten my yogurt, then my recommendation would be to choose plain yogurt and add your own fruit and your own honey, because it will probably be 75% less added sugar. You can see on the slide the recommendations for added sugars as set forth by the American Heart Association. I know it's really tiny, isn't it? 24 grams or less of added sugar a day for women, and 36 grams of added sugar or less a day for men. That's the goal. So, I have to be honest. I sometimes think that we get a little too fixated on this when, in my opinion, the goal of eating in life is to have fun, to enjoy what you're eating and not to be hyper focused on counting every little thing. So I just want to say that there will be some days that all of us go over that 24 or 36 grams. And there'll be some days we're under. It's more about what's the average over time. What's the average amount of added sugar you're getting in? And the way you can figure that out is just like think through what foods do you eat that contain a lot of added sugar? Breakfast cereal is a really interesting one. And if somebody wants to go do this, we can do it together and I can give you a little trick on breakfast cereal. Actually, I'm going to stop sharing my screen a minute because I really want to see your faces. Okay. So let's do a little thing on that you can use for granola bars and for breakfast cereals. Okay. I'm going to give you a little mathematical equation you can use for breakfast cereal and granola bars. Okay. And it's not to get rid of breakfast cereal and granola bars, but it's to think about how much added sugar they're contributing to your daily intake. So the first thing you look at on the breakfast cereal is the grams of protein. Oh, it's got something.
I just have this little, it's called Daydreaming About Donuts. So it's a donut flavored granola type bar.
Okay,
and
let's use it.
Oh, it said, okay, well, this is what it looks like.
Okay.
And it says no gluten, no dairy, no soy, no sugar, alcohols, 180 calories, 12 grams of protein.
Okay, so I said the first thing we're looking for, which is grams of protein, 12 grams of protein. How many grams of fiber are in that bar?
That's what I'm looking for.
Okay, and what does that? I'm going to put into the chat the formula. Okay, so it's grams of protein plus grams of fiber is greater than grams of added sugar. You got the fiber?
Oh, 11 grams.
Yes. We're adding protein and fiber. So we've got 12 plus 11, you said, right? So 23 grams.
Yeah.
This is very good. How many grams of added sugar are in there?
That's what I was just looking at. 7 grams of added sugar.
Okay. So it's protein plus fiber. That number should be bigger than the grams of added sugar. So protein plus fiber, 12 plus 11 was 23. That was much bigger than 7, right? This works best for bars and breakfast cereals. It doesn't work for everything. Okay, this is just for but you can see here that protein and fiber are going to offset the added sugar, right? Here's the takeaway message with added sugars, okay? It's not about having zero. It's not about getting rid of foods that you really enjoy. But if there's a food you have on a regular basis that's high in added sugar, like the yogurt example I gave, then there are things we can do to come up with a version of that food that you can still really enjoy while we still get the added sugars reduced to the best of our ability. Okay. With regard to this sugar topic and many others, like, do I have to be organic? Do I have to be vegan? What about dairy? What about alcohol? What about soy? Yada, yada, right? There are, I do webinars on this type of topic that are available for free that you can watch on demand at your leisure. And I just wanted to share where you can find this stuff if you ever want to. The QR code is one way you can use. You can point your smartphone at the QR code, or you can just go to our website. And in addition to the webinars that you can watch are lots of articles. Remember how I told you I'm going to give you that smoothie article with the recipes? These are the smoothies that I'm going to. So there's lots of articles here that you can just access for free. My mission is to make sure as many people as possible get access to high quality and free nutrition education on the topic of nutrition and cancer. And if you want, you can also come be in my kitchen with me every other month, where I do free live webinars. They're like live streams. We have fun. We cook something and we talk about questions related to cancer, and people can type their questions in real time. And you are all welcome to come anytime you want. And the next one is November 15th, and it's going to be about things around the holidays. And we're going to be focused on cranberries, like what to do with a bag of frozen cranberries. Because believe it or not, frozen cranberries, which people usually only buy once a year, stock up this year because I got some recipes for you. They're actually quite nutritious, and there's a lot you can do with them. We're going to spend the rest of today hearing from you. Oh, and we're going to talk about cholesterol and cooking for one. But what other questions do you have?
Diet for treatment that gives you GI issues.
Yes.
Had asked about that. She's on Tagrisso and Alimta, and it causes stomach issues. And I think that this is a pretty common theme I hear.
Yes.
So
Yes, it is. The two challenges people have are loose stool, gas, bloating, discomfort, digestive troubles, and the opposite extreme where they can't go to the bathroom and then going back and forth between the two, which is really very annoying. So I have a webinar on that actually that everyone's available to download, and I'm going to pull that up. It's interesting because I put that information inside of a webinar I did on GI cancer because that's where it's like every single person is experiencing it. So oftentimes people don't know where to find it because they're like, well, I don't have GI cancer. Why would I watch that webinar? But the list, I have a slide. I wonder if I can find it fast enough to show you the slides of like, if you're experiencing gas, bloating, diarrhea, loose stool, here's the foods to eat and foods to avoid. If you're experiencing the other problem, here's the foods to eat, foods to avoid. While we're talking, I'm gonna take a second here and find that. And Lynn, you can ask me another question because I think I can find it while I'm looking.
okay, super. Well, mention that as a single man, that food pyramid system is troublesome to plan and execute. And I think you touched on, when you're cooking for one, but he also wanted to know about your thoughts on frozen dinners like Healthy Choice and things like that too. So
Yes to frozen dinners. First of all, that's right out of the gate, because quite honestly, those are, particularly because you can find a lot of really good ones now that are that have 20 plus grams of protein. And people say, oh, but the sodium, guess what? Sodium is actually, it is a concern. But the concern is when people's blood pressure is non-responsive to medications and otherwise, in this instance, the amount of nutrients, vitamins, and minerals a person can get, not to mention protein, in a frozen dinner, the frozen dinner is a perfectly good choice. Now, some people also buy to go along with it, like, a bag of salad that's ready to go, or a broccoli, like some sort of prepared salad at the deli, or just like I said, a bag of leafy greens and they put a dressing on it to eat alongside it. There's absolutely no reason to avoid frozen dinners at all. I'm glad you asked the question, Fred.
okay, awesome. Thank you. Do you want me to go on to the next question?
Yeah, keep going. I'm still looking, but I'm going to find it soon. I know it.
Okay. Well, as mentioned, she said that she's had her left lung removal. It caused shifting, and that has caused a form of acid reflux. She's also had an unusual side effect, and that is that her stomach turning upside down into an empty space. So she's had surgery to fix that, but now she suffers from a mild digestive motility disorder, and she's also lost a lot of weight, and she may also have some food allergies. Any ideas or suggestions?
Quickly, do you have a dietitian that you've been able to work with one-on-one?
I have, my daughter's a dietitian, and then I have another dietitian. So far, there are no answers.
Yeah.
Any of the supplements, besides the fact I have dairy issues, which developed the last bout of treatments I had. I didn't have dairy and eggs issues before that.
Do you know about Ripple?
That sounds familiar, yes.
Ripple products for people who don't tolerate dairy or have a dairy allergy. Ripple, it's RIPPLE, is a great brand. By the way, I don't work for any companies or
right. I just wrote that. It sounds familiar.
Yeah.
I don't know if I've read about that one, because let me tell you, I have a diary. And everything I eat, all protein and all calories, everything I eat is charted all day long. The last treatment also gave me a form of thyroid condition. So I keep thinking if we can straighten that out, maybe I'll gain weight.
One other thought I have for you is the stomach inversion situation responsive to positional changes for you?
No, they went ahead and fixed it. What happened is my stomach actually went through a hole, flipped upside down, and went under my rib, my shoulder. They put it back in place, but by the time they put that back in place, I've already had ovarian and uterine cancer. So the surgeries done in that area were already affecting the digestive system.
Yes.
And this just did a job. And I keep hoping someone can give me an answer.
I know. I wish it was me. I mean, this isn't something I have experienced this in with other patients in the past. It's just this. It's a complex thing, as you know. It's a pretty complex thing. And I wish I had a straightforward answer for you, but it's pretty nuanced. And yeah, I mean, the only other thing you could explore, depending on what your digestive challenges are right now, would potentially be a probiotic. But you've already tried a lot of supplements, it sounds.
I tried a lot of supplements. Yeah. I thought it was interesting. The pulmonologist suggested, I'm going to say it wrong, sucralfate.
Oh, sucralfate.
Right. But that interferes with my thyroid medication. And she wants me to take it 3 times a day. I have to eat at least 6 times a day.
Yeah.
They have to be taken. So I tried one day and I said, this just isn't going to happen. I can't have my thyroid messed up.
No, you're right. You're right.
I have to make a choice.
Yeah. All right. Well, I'm going to keep thinking on this one. And I wish I had something that, like I said, was a sure bet. And unfortunately, it's a little bit more complex than I can do in a generalized session. I also just want to appreciate the humor in the chat that apparently I did not know Ripple was a cheap form of wine previously. So, hey, all right. I'm seeing in the chat, sugar substitute like Splenda, the same. No, Splenda does not add added sugar. There's also stevia. That is an herbal sweetener.
I posted that question about cholesterol.
Yes. So here's the quick and dirty on cholesterol. The types of things that elevate cholesterol are saturated fat and trans fat. So saturated fat comes from red meat, full fat dairy, so like whole milk, ice cream, and full fat yogurt, butter, and bacon. So anything that comes from an animal is a full fat version, and also trans fat. Trans fat is a real bugger because it's a human invention. It was invented in the 1950s to make shelf life of foods longer. And how you'll find trans fat on labels is by looking for these words. You'll see them on the food label. I'm typing them in the chat. Partially hydrogenated. Have you seen these words? Yeah, okay. Partially hydrogenated. If you see those 2 words in the ingredients list of your crackers or your salad dressing or your bread, anything that comes in a package, if you see partially hydrogenated in the ingredient list, it means it contains that type of fat. Now, people will say, how much of that can I eat? The goal on trans fat is to eat 1 gram or less a day. The problem is that food manufacturers can claim 0 grams on the label if they only used half a gram or less when they were making the food. So if you were to look at a box of crackers and on the line that says includes trans fat, it says 0 grams, you still want to look down in the ingredients list to see if you can see those words partially hydrogenated. Because those words are telling you that even though they're saying 0 grams on the label, that's because there's only half a gram per serving or less. But if you eat 2 servings, you're already at the amount that you should have for the whole day. Does that make sense?
Now, in my case, I started taking Lorbrena.
Yeah.
And it was with that my cholesterol shot through the roof.
Yeah.
Was 500 and something at first. And then I started taking Crestor to control it.
Yep.
And it's coming down, but it's not at the normal level. So I don't know if I can, with food, try to bring it down some more.
Yeah. Perhaps it's great that you're thinking about this. Food and walking, like 30 minutes, 3 to 5 times a week, will probably help. I will be honest and tell you, in my experience, some people have a genetic, like their cholesterol doesn't have anything to do with what they're eating. They eat everything, quote unquote, just right. I don't believe in anything such as like a perfect diet. Like they take out all the cholesterol and they take out all the saturated fat and they're eating very little trans fat, if any at all. And still, it's like treatment induced elevated cholesterol. And they end up really just needing to be on a different level of cholesterol medication, because treatment can cause elevation, in particularly if people have a genetic predisposition to higher cholesterol. It's frustrating, isn't it?
Yeah.
Now, do you eat?
And I gained 10 pounds. I don't know if that's related, but with that medication, I gained 10 pounds and I can't lose it.
The only other thing I would suggest is, do you eat fish?
Yeah.
Okay. Because eating fish like salmon, haddock, halibut, whatever fish you like 2 to 3 times a week also can help with lowering cholesterol.
I was looking for tips on mindful eating.
Oh, yes. That's one of my favorite things. Okay. Boy, there's so many, Maria. I'm going to think of the first thing I can send you to do. Okay. There's something called the Center for Mindful Eating. I'm going to put it into the chat. Actually, their acronym is TCME, which stands for the Center for Mindful Eating. They have an excellent, if you just Google that, that's going to be your best bet for getting started with exercises, ideas, reading about mindful eating. And then there's one other fun thing to do if you're up for it that you could also Google. And you could just type in into Google, who's hungry in their meditation. Now, that's going to take you to an 8-minute and 30-second audio recording that you'd want to do when you have a bowl or a plate or something, some kind of food in front of you. And you eat while you listen. You can have your earbuds, whatever. Listen to that thing while you eat, and it guides you through a mindful eating exercise. It's, hang with it in case you think it sounds a little woo-woo at first. Like you can get some interesting information out of it, I think. That it's fun for a little 8-minute experiment. Okay, I don't want to leave this meeting though until I find that GI. I didn't find that GI thing yet, and I really want to put it in there. And we also didn't talk about cooking for one. Yeah. So I know we're a little over. I have to go to another meeting in like 4 minutes, but hold on. Why don't talk amongst yourselves? I'm going to go find that and come back and put it in the chat. Because for some reason I was having a hard time finding it. I'm more interested in looking at you and talking to you than I am for actually searching for something, but I'm going to find it. So
while you're searching, Stephanie, would you mind if I ask you about exercise and your feelings about chair yoga?
Love chair yoga. Love it.
Okay.
I used to teach yoga actually for many years, and I think chair yoga is fantastic.
Okay, awesome. And added sugar, does that cause inflammation? And what about natural glucose? Does it add to inflammation?
This is a good question. Added sugar in excess, really high quantities, is believed to be a contributor toward inflammation. But here's the thing. It's really important that I say this. Sometimes people say to me, oh, if I only had eaten better, I wouldn't be in this situation. And I really believe that is not true. Cancer is such a complex thing. There's no one food or food group that if people would just eat less of it, they wouldn't have as many challenges. I mean, it's not that direct of a link. Does that make sense? It's really more like the whole overall way of eating. And so when I answer that way, like, maybe we do think that really high amounts of added sugar can contribute to inflammation. That's still not enough by itself to cause a cancer progression. Does that make sense? So it's more like one of those things you can do to help slow down risk of cancer or risk of infection or risk of elevated blood sugar or risk of other things we've been talking about. But it's not that people should feel a sense of blame or guilt. It's not like that. I hope that's making sense.
Wonderful. Thank you. No, that's perfect. And then last question we have in here was instead of sugar, substituting raw honey. Is that that's a better choice?
Great. Yep, absolutely.
Perfect. Awesome.
Absolutely. I found it. I'm so happy because I'm coming back
Oh,
to you
you did
now.
find it. Oh, awesome. I was
Okay,
going to say,
yep.
if not, you can always just send it to me and I will share it with the group. So
Going in the chat right now. Okay.
Awesome.
There's the link to that webinar. That's going to talk you through the GI, what to eat in each of the situations digestively. And I just want to say thank you again to all of you for inviting me into your home for an hour. It's been a distinct pleasure to be with you. I wish you all the very best. And hey, maybe I'll see some of you live in my kitchen in November. I would love it. And we do those every other month. So it'll be November and January and March, and we're like lining up the topics. So it's every other month on a Wednesday at 1 for a half an hour. Get a recipe and a chance to ask whatever questions come up. And it's my thank you.